Question 1. System analysis indicates a healthcare organization is experiencing increased patient wait times in its emergency department, leading to staff frustration and a perceived pressure to expedite patient flow. During a recent team meeting, a nurse reported a near miss where a medication error was almost administered due to a labeling issue, but was caught by a colleague. The nurse expressed concern that such issues might be overlooked if staff feel pressured to rush. The department manager, while acknowledging the wait time issue, suggested focusing on getting patients seen faster and advised the reporting nurse to be more vigilant in the future, implying the error was solely due to individual oversight. Which of the following approaches best reflects an understanding of safety culture in this scenario? Option A. The department manager should initiate a formal review of the medication labeling process, involve frontline staff in identifying contributing factors to the near miss, and reinforce the importance of reporting all safety events, including near misses, without fear of blame. Option B. The department manager should implement stricter protocols for medication administration and conduct mandatory retraining on medication safety for all staff, emphasizing individual accountability for errors. Option C. The department manager should focus solely on optimizing patient flow algorithms and scheduling to reduce wait times, as this is the primary driver of staff frustration and potential safety compromises. Option D. The department manager should dismiss the near miss as a minor incident that was successfully averted, and instead concentrate on addressing the root causes of patient wait times through increased staffing and resource allocation. The correct answer is A. The department manager should initiate a formal review of the medication labeling process, involve frontline staff in identifying contributing factors to the near miss, and reinforce the importance of reporting all safety events, including near misses, without fear of blame. Explanation. This scenario is professionally challenging because it requires balancing immediate operational demands with the foundational principles of a robust patient safety culture. The pressure to maintain service delivery can inadvertently lead to the erosion of reporting mechanisms and a reluctance to address systemic issues, which are critical for long-term safety improvement. Careful judgment is required to prioritize safety without compromising essential patient care. The correct approach represents best professional practice because it directly addresses the core tenets of a positive safety culture, as outlined by regulatory bodies and patient safety frameworks. By actively encouraging reporting, investigating near misses, and involving frontline staff in solutions, the organization demonstrates a commitment to learning from errors and near misses. This aligns with the principles of a just culture, where individuals are held accountable for reckless behavior, but system vulnerabilities are identified and corrected without punitive measures for honest mistakes. This proactive stance is often implicitly or explicitly supported by healthcare regulations that mandate quality improvement and patient safety initiatives. An incorrect approach that focuses solely on punitive measures for errors, without investigating systemic causes, fails to foster a culture of psychological safety. This can lead to underreporting of adverse events and near misses, as staff fear retribution. Such an approach violates the ethical obligation to create a learning environment and can contravene regulatory expectations for comprehensive incident analysis and quality improvement. Another incorrect approach that dismisses near misses as insignificant overlooks a critical opportunity for proactive risk mitigation. Regulatory frameworks and patient safety guidelines emphasize the importance of analyzing near misses to prevent future harm. Ignoring these events represents a failure to implement a systematic approach to patient safety and can lead to repeated preventable errors. A third incorrect approach that prioritizes speed of service over thorough investigation of safety concerns demonstrates a flawed understanding of patient safety culture. While efficiency is important, it should not come at the expense of identifying and rectifying underlying safety issues. This can lead to a superficial approach to problem solving, where immediate symptoms are addressed without tackling root causes, ultimately undermining patient safety and potentially violating regulatory requirements for effective quality management. The professional decision-making process for similar situations should involve a framework that prioritizes 1. Upholding ethical obligations to patient safety. 2. Adhering to relevant regulatory requirements for quality improvement and incident reporting. 3. Fostering a culture of psychological safety where staff feel empowered to report concerns without fear of reprisal. 4. Implementing systematic processes for incident analysis, including near misses, to identify root causes and develop effective mitigation strategies. 5. Engaging frontline staff in the safety improvement process, recognizing their invaluable insights. Question 2. Risk assessment procedures indicate a consistent pattern of minor deviations from a critical patient care protocol by frontline staff during high-acuity shifts. These deviations, while not immediately resulting in adverse events, are linked to increased staff reports of feeling overwhelmed and rushed. The primary goal is to optimize the process to enhance patient safety and reduce the likelihood of future errors. Which of the following approaches best addresses this situation? Option A. Develop a supplementary, more detailed checklist to be used in conjunction with the existing protocol, aiming to ensure all steps are meticulously followed. Option B. Implement stricter disciplinary measures for any staff member found deviating from the protocol, emphasizing the importance of adherence regardless of perceived workload. Option C. Conduct a thorough review of the protocol to identify specific points that may be contributing to cognitive overload, and redesign the workflow or protocol to simplify steps, provide clearer decision-making aids, or redistribute tasks to mitigate this overload. Option D. Issue a general reminder to all staff about the importance of following the protocol precisely and the potential consequences of non-adherence. The correct answer is C. Conduct a thorough review of the protocol to identify specific points that may be contributing to cognitive overload, and redesign the workflow or protocol to simplify steps, provide clearer decision-making aids, or redistribute tasks to mitigate this overload. Explanation. This scenario is professionally challenging because it requires balancing immediate patient needs with systemic process optimization, all while acknowledging the inherent limitations of human cognitive capacity under pressure. The healthcare professional is faced with a situation where a deviation from standard protocol, while potentially effective in the short term, could have long-term implications for patient safety if not addressed through a systemic lens. Careful judgment is required to identify the root cause of the deviation and implement sustainable solutions, rather than merely addressing the immediate symptom. The correct approach represents best professional practice because it prioritizes a systematic review and optimization of the process. This aligns with the core principles of patient safety, which emphasize proactive identification and mitigation of risks. By analyzing the cognitive load contributing to the deviation, the professional is addressing a fundamental factor that can lead to errors. This approach is ethically sound, as it seeks to improve the system for all future patients, not just the one currently being managed. It also aligns with regulatory frameworks that mandate continuous quality improvement and risk management within healthcare settings, encouraging a move beyond individual blame to systemic accountability. An incorrect approach that focuses solely on reprimanding the individual clinician for deviating from protocol fails to address the underlying systemic issues. This is ethically problematic as it can foster a culture of fear and discourage reporting of errors or near misses, which are crucial for learning and improvement. It also represents a regulatory failure by neglecting the mandate to identify and rectify systemic vulnerabilities that contribute to adverse events. Another incorrect approach, which involves simply reinforcing the existing protocol without investigating the reasons for deviation, ignores the possibility that the protocol itself may be contributing to cognitive overload or is impractical in certain real-world scenarios. This approach is a failure in professional reasoning as it does not engage in root cause analysis and therefore fails to implement effective, sustainable solutions. It can lead to repeated deviations and potential harm. A third incorrect approach, which involves creating a new, more complex protocol to prevent future deviations, could inadvertently increase cognitive load and introduce new risks. This demonstrates a lack of understanding of how complex systems can exacerbate human error. Effective professional decision-making in such situations involves a structured approach. First, assess the immediate patient situation and ensure safety. Second, gather information about the deviation, including contributing factors like cognitive load. Third, analyze the root causes within the system. Fourth, develop and implement evidence-based solutions that optimize the process and reduce cognitive burden. And finally, monitor the effectiveness of the implemented changes. Question 3. The monitoring system demonstrates a statistically significant increase in medication errors related to a specific high-alert medication over the past quarter. Which of the following represents the most appropriate next step for the patient safety team? Option A. Initiate a comprehensive root cause analysis, RCA, involving frontline staff, pharmacy, and nursing leadership to identify contributing factors and develop targeted interventions. Option B. Classify the increase as a statistical anomaly and continue current monitoring protocols without further investigation. Option C. Recommend a temporary suspension of the use of that specific high-alert medication until further notice. Option D. Counsel the nurses involved in the reported errors to reinforce proper medication administration protocols. The correct answer is A. Initiate a comprehensive root cause analysis, RCA, involving frontline staff, pharmacy, and nursing leadership to identify contributing factors and develop targeted interventions. Explanation: scenario analysis. This scenario presents a common challenge in patient safety implementation: the gap between data collection and actionable improvement. While a monitoring system can identify trends and potential risks, its effectiveness hinges on how that data is interpreted and translated into tangible changes in practice. The professional challenge lies in moving beyond mere data reporting to a proactive, systems-based approach to safety improvement, ensuring that identified issues are addressed effectively and sustainably. This requires critical thinking, collaboration, and a deep understanding of patient safety frameworks. Correct approach analysis. The correct approach involves a systematic review of the monitoring data to identify root causes of the observed trends, followed by the development and implementation of targeted interventions based on established patient safety models. This aligns with the principles of continuous quality improvement and systems thinking, which are fundamental to effective patient safety programs. Specifically, utilizing frameworks like the Swiss cheese model or root cause analysis, RCA, allows for a thorough investigation of contributing factors, moving beyond individual blame to systemic vulnerabilities. Regulatory guidelines and ethical obligations mandate that healthcare organizations actively seek to prevent harm, and this approach directly addresses that by using data to drive evidence-based improvements. Incorrect approaches analysis. One incorrect approach focuses solely on individual performance without investigating systemic factors. This violates ethical principles by potentially leading to punitive actions against staff, without addressing underlying organizational or process issues that contributed to the adverse events. It also fails to leverage patient safety frameworks that emphasize systems thinking and error prevention. Another incorrect approach involves implementing generic, unvalidated interventions without a clear understanding of the root causes. This is inefficient and potentially ineffective, wasting resources, and failing to address the specific safety concerns identified by the monitoring system. It represents a failure to adhere to best practices in quality improvement, which require data-driven decision-making and evidence-based interventions. A third incorrect approach is to dismiss the data as anomalous without further investigation. This demonstrates a lack of commitment to patient safety and a failure to recognize the potential for systemic issues to manifest as seemingly isolated incidents. It ignores the ethical imperative to proactively identify and mitigate risks to patient well-being. Professional reasoning. Professionals should approach such situations by first acknowledging the data's significance. The next step is to engage in a structured problem-solving process, often guided by patient safety frameworks. This involves forming a multidisciplinary team to analyze the data, conduct root cause analyses for significant trends, and then collaboratively design and implement interventions. The effectiveness of these interventions should then be continuously monitored, creating a feedback loop for ongoing improvement. This systematic, data-driven, and collaborative approach ensures that efforts are targeted, effective, and aligned with ethical and regulatory expectations for patient safety. Question 4. Investigation of a recent near-miss event involving a medication administration error at a healthcare facility prompts a review of the facility's safety protocols. The event involved a nurse administering a medication to the wrong patient due to a failure in the bedside verification process. Considering the historical evolution of patient safety practices in the United States, which of the following approaches best reflects an understanding of the foundational principles that led to current regulatory requirements for preventing such errors? Option A. Dismissing the near miss as a minor incident that does not warrant significant procedural changes, given that no actual harm occurred to the patient. Option B. Implementing a mandatory, facility-wide retraining program for all nursing staff on medication administration, emphasizing the importance of individual vigilance and attention to detail. Option C. Conducting a thorough root cause analysis that examines the systemic factors contributing to the near miss, including the effectiveness of existing verification protocols, communication pathways, and the facility's culture around reporting errors, drawing parallels to historical patient safety initiatives and their impact on current Joint Commission standards. Option D. Updating the facility's policy manual to include a stricter disciplinary action for any future medication administration errors, aiming to deter future occurrences through punitive measures. The correct answer is B. Implementing a mandatory, facility-wide retraining program for all nursing staff on medication administration, emphasizing the importance of individual vigilance and attention to detail. Explanation. This scenario presents a professional challenge because it requires understanding how historical patient safety failures, particularly those related to medication errors and communication breakdowns, have shaped current regulatory frameworks and best practices. The challenge lies in identifying the root causes of past incidents and recognizing how they directly inform the development of specific safety protocols and reporting mechanisms that are now mandated. Careful judgment is required to distinguish between superficial responses and those that address the systemic issues illuminated by historical context. The correct approach represents best professional practice because it directly acknowledges and applies lessons learned from historical patient safety events. This involves understanding how landmark incidents, such as those highlighted by the Institute of Medicine's reports, led to the establishment of mandatory reporting systems, the emphasis on a just culture, and the development of standardized communication tools like SBAR. Adhering to these historically informed practices ensures compliance with current regulations, which are a direct consequence of past failures, and promotes a proactive safety culture. This approach demonstrates a commitment to continuous improvement by leveraging past experiences to prevent future harm, aligning with the core principles of patient safety as defined by regulatory bodies. An incorrect approach that focuses solely on immediate incident response without considering the historical context fails to address the underlying systemic issues that led to the incident. This represents a regulatory failure because it overlooks the evolution of patient safety standards, which were specifically designed to prevent recurrence of past harms. Ethically, it is unacceptable as it prioritizes a reactive rather than a proactive approach to safety, potentially leaving vulnerabilities unaddressed. Another incorrect approach that dismisses the relevance of historical data as outdated or irrelevant is a significant ethical and regulatory failure. Patient safety regulations are built upon a foundation of documented failures and their subsequent remediation. Ignoring this history means failing to understand the rationale behind current safety mandates and potentially repeating past mistakes. This demonstrates a lack of professional due diligence and a disregard for the established body of knowledge in patient safety. A further incorrect approach that focuses on individual blame rather than systemic factors is also professionally unacceptable. Historical analysis of patient safety incidents consistently shows that errors are rarely due to isolated individual negligence, but rather to systemic flaws. Regulations and ethical guidelines now emphasize a just culture, which encourages reporting without fear of retribution for honest mistakes, while holding individuals accountable for reckless behavior. Focusing on blame undermines this principle, discourages reporting, and prevents the identification and correction of systemic vulnerabilities. The professional decision-making process for similar situations should involve a thorough review of the incident, including its historical context. This means asking, what similar events have occurred in the past? What were the root causes identified then? What regulations or protocols were put in place as a result? How do current practices align with or deviate from these historically informed standards? This analytical framework allows for a comprehensive understanding of the incident, ensuring that the response is not only immediate, but also addresses the systemic issues that have been recognized as critical to patient safety over time, thereby ensuring compliance with regulatory expectations and upholding ethical obligations. Question 5. What factors determine the effectiveness of a medication administration system's design in preventing errors, considering the interaction between healthcare professionals and the system's physical and cognitive demands? Option A. The number of years of experience the healthcare professional has administering medications. Option B. The degree to which the system's design accounts for human cognitive limitations, physical capabilities, and the environmental context in which it is used. Option C. The availability of advanced technological features within the medication administration system, regardless of user interface design. Option D. The perceived difficulty of the tasks involved in medication administration by the healthcare professional. The correct answer is B. The degree to which the system's design accounts for human cognitive limitations, physical capabilities, and the environmental context in which it is used. Explanation. The scenario presents a common challenge in patient safety, a system design that inadvertently increases the risk of error due to a mismatch between human capabilities and the task demands. The professional challenge lies in identifying the root cause of the near miss, which stems from human factors rather than individual blame. Careful judgment is required to move beyond a superficial understanding of the event and delve into the systemic influences that contributed to the error. The correct approach focuses on a comprehensive impact assessment of human factors and ergonomics. This aligns with the core principles of patient safety, which emphasize proactive identification and mitigation of risks. By systematically evaluating how the design of the medication administration system, e.g., layout, labeling, workflow, cognitive load, interacts with the cognitive and physical limitations of the healthcare professional, it allows for targeted interventions. This approach is best professional practice because it addresses the underlying systemic issues that lead to errors, thereby preventing future occurrences. It is ethically mandated to provide safe patient care and aligns with regulatory frameworks that promote a systems-based approach to safety, such as those emphasizing a just culture and continuous quality improvement. An incorrect approach that solely focuses on individual performance or blame fails to acknowledge the systemic nature of errors. This is a regulatory and ethical failure because it can lead to a punitive environment, discouraging reporting and hindering learning from mistakes. It also fails to address the root cause, leaving the system vulnerable to similar errors in the future. Another incorrect approach that relies on anecdotal evidence or superficial observations lacks the rigor necessary for effective safety interventions. This is professionally unacceptable as it is unlikely to identify the true contributing factors and may lead to ineffective or even counterproductive solutions, wasting valuable resources and potentially increasing risk. The professional decision-making process for similar situations should involve a structured approach to incident analysis. This includes gathering detailed information about the event, identifying all contributing factors, both human and environmental, and then systematically evaluating the impact of these factors on patient safety. A human factors and ergonomics lens is crucial for understanding how the design of the work environment and tasks influences performance. This leads to the development of evidence-based intervention that aim to reduce error likelihood and severity, rather than simply punishing individuals. Question 6. When evaluating a recent near miss involving a medication administration error, which of the following strategies best supports the development of a robust patient safety culture? Option A. Deciding to not formally investigate the near miss to avoid creating unnecessary alarm among staff and to maintain morale. Option B. Focusing solely on retraining the individual staff member involved without exploring broader systemic or environmental factors. Option C. Immediately initiating disciplinary proceedings against the staff member directly involved in the near miss to ensure accountability. Option D. Conducting a thorough, non-punitive review to identify all contributing factors, including system-level issues, and implementing appropriate organizational changes. The correct answer is D. Conducting a thorough, non-punitive review to identify all contributing factors, including system-level issues, and implementing appropriate organizational changes. Explanation. This scenario presents a common ethical dilemma in patient safety, balancing the immediate need for transparency and learning with the potential for negative repercussions on staff morale and reporting behaviors. The challenge lies in fostering a culture where errors are seen as opportunities for improvement, not solely as grounds for punishment. Careful judgment is required to implement strategies that encourage open communication without undermining trust or creating a climate of fear. The correct approach prioritizes a systemic view of safety, focusing on understanding the contributing factors to the near miss rather than assigning blame to individuals. This aligns with the principles of just culture, which differentiates between human error, at-risk behavior, and reckless behavior, and emphasizes learning from all events. By conducting a thorough, non-punitive review, the organization demonstrates its commitment to patient safety as a shared responsibility and encourages future reporting, which is crucial for identifying and mitigating risks. This proactive approach is supported by regulatory frameworks that emphasize continuous quality improvement and a learning healthcare system. An incorrect approach that focuses solely on disciplinary action for the individual involved fails to address the underlying systemic issues that may have contributed to the near miss. This can lead to a culture of silence, where staff fear reporting errors or near misses, thereby hindering the organization's ability to learn and improve. Such an approach may also violate ethical principles of fairness and due process, and could be inconsistent with regulatory expectations for a robust patient safety program that encourages reporting and learning. Another incorrect approach that involves downplaying the incident or avoiding a formal review risks perpetuating unsafe practices. This demonstrates a lack of commitment to patient safety and can erode staff confidence in leadership's dedication to creating a safe environment. It fails to leverage the learning opportunity presented by the near miss, potentially leading to similar events with more severe consequences. This approach is antithetical to the principles of a learning healthcare system and may fall short of regulatory requirements for incident reporting and analysis. Finally, an approach that focuses on individual performance improvement without a broader systemic analysis might miss critical organizational factors. While individual accountability is important, a near miss often arises from a confluence of factors, including system design, communication breakdowns, or inadequate training. Focusing only on the individual can be a superficial fix that does not prevent recurrence. The professional decision-making process for similar situations should involve 1. Immediate containment of any patient risk. 2. A commitment to a non-punitive review process that encourages open reporting. 3. A thorough root cause analysis or similar methodology to identify all contributing factors, both individual and systemic. 4. Development and implementation of sustainable solutions to prevent recurrence. 5. Communication of findings and actions taken to relevant stakeholders to reinforce a culture of safety and learning. Question 7. The risk matrix shows a near-miss event related to medication administration has been categorized as low likelihood and low impact. The team is under pressure to meet performance targets. Which of the following approaches best aligns with fostering a proactive patient safety culture in this context? Option A. Focus solely on the individual's adherence to protocol during the near-miss event and consider disciplinary action if deficiencies are found. Option B. Immediately implement additional training for the individual staff member involved to reinforce correct procedures. Option C. Document the near-miss and move on, as the low impact means it does not warrant significant resource allocation for investigation. Option D. Conduct a thorough, blame-free investigation to identify contributing system factors and involve frontline staff in developing solutions to prevent recurrence. The correct answer is D. Conduct a thorough, blame-free investigation to identify contributing system factors and involve frontline staff in developing solutions to prevent recurrence. Explanation: this scenario is professionally challenging because it requires balancing immediate operational pressures with the long-term imperative of fostering a robust patient safety culture. The healthcare team is faced with a situation where a near-miss event, though not resulting in harm, highlights systemic vulnerabilities. The pressure to maintain service delivery and manage workload can easily lead to overlooking the deeper cultural issues that allowed the near-miss to occur. Careful judgment is required to ensure that the response addresses both the immediate incident and the underlying cultural factors that contribute to patient safety. The correct approach represents best professional practice because it prioritizes a systematic, blame-free investigation that seeks to understand the root causes of the near miss within the existing safety culture. This aligns with the principles of just culture, which encourages reporting of errors and near misses without fear of retribution, thereby promoting transparency and learning. By involving frontline staff in the analysis and solution development, it empowers them and increases the likelihood of sustainable improvements. This proactive approach to identifying and mitigating risks before they lead to harm is a cornerstone of effective patient safety management and is implicitly supported by regulatory frameworks that emphasize continuous quality improvement and a commitment to patient well-being. An incorrect approach that focuses solely on individual performance without examining systemic factors fails to address the root causes of the near miss. This can lead to a culture of fear and underreporting, as staff may become hesitant to report errors or near misses for fear of punitive action. This directly contravenes the principles of just culture and hinders the organization's ability to learn from its experiences, potentially leading to repeated incidents. Such an approach also neglects the ethical obligation to create a safe environment for both patients and staff. Another incorrect approach that dismisses the near miss as a minor event without further investigation ignores the potential for escalation. Near misses are critical indicators of latent system failures. Failing to investigate them is a failure to proactively manage risk and can be seen as a dereliction of the professional duty to ensure patient safety. This approach can lead to a false sense of security while underlying systemic weaknesses persist, increasing the likelihood of future, potentially more severe, adverse events. This also represents a failure to adhere to quality improvement mandates that require thorough analysis of all safety events. A third incorrect approach that involves immediate disciplinary action against the individual involved, without a thorough investigation into the contributing systemic factors, is a clear violation of just culture principles. It fosters a punitive environment, discourages reporting, and fails to identify and address the organizational or system-level issues that may have contributed to the near miss. This approach not only undermines patient safety efforts, but also creates a toxic work environment, impacting staff morale and retention. The professional decision-making process for similar situations should involve a structured approach to incident analysis. This begins with immediate patient safety measures, followed by a comprehensive investigation that employs a framework like root cause analysis. The focus should be on understanding why the event occurred, not just who was involved. Engaging frontline staff, fostering open communication, and implementing system-level changes based on findings are crucial. The ultimate goal is to learn from every event, regardless of outcome, to continuously improve the safety culture and prevent future harm. Question 8. Cost-benefit analysis shows that investing in standardized communication tools and training for healthcare teams significantly reduces adverse events related to miscommunication. Considering the Certified Professional and Patient Safety Framework, which of the following strategies best embodies an effective approach to risk assessment in healthcare communication? Option A. Encouraging team members to use their own preferred communication methods, believing this fosters individual efficiency. Option B. Minimizing detailed communication during busy periods to avoid overwhelming staff, assuming critical information will be conveyed when time permits. Option C. Relying on informal verbal updates between shifts, assuming team members will recall all essential patient details. Option D. Implementing a structured handoff protocol that includes a readback mechanism for critical information and encourages active listening among team members. The correct answer is D. Implementing a structured handoff protocol that includes a readback mechanism for critical information and encourages active listening among team members. Explanation. This scenario presents a professional challenge due to the inherent risks associated with miscommunication in a healthcare setting, particularly when dealing with patient safety. The need for clear, concise, and accurate information exchange between healthcare professionals is paramount to prevent medical errors, ensure continuity of care, and uphold patient well-being. The pressure of time, diverse communication styles, and potential for information overload can exacerbate these risks, demanding a structured and effective approach to communication. The correct approach represents best professional practice because it directly addresses the core principles of effective patient safety communication, as outlined by regulatory bodies and professional guidelines. This approach prioritizes a standardized, structured method of information exchange that minimizes ambiguity and ensures all critical details are conveyed. It aligns with the ethical imperative to provide safe and competent care and the regulatory requirement to implement systems that reduce the likelihood of adverse events. By focusing on active listening, confirmation of understanding, and the use of clear, unambiguous language, this strategy directly mitigates the risks of misinterpretation and omission, thereby enhancing patient safety. An incorrect approach that relies on assumptions or informal communication fails to meet professional standards. Such methods can lead to critical information being overlooked or misunderstood, directly violating the duty of care owed to patients. This can result in diagnostic errors, medication mistakes, or delays in treatment, all of which are preventable adverse events. Ethically, This demonstrates a lack of diligence and a failure to prioritize patient safety. From a regulatory standpoint, it may contravene guidelines that mandate clear documentation and communication protocols designed to prevent harm. Another incorrect approach that involves bypassing established communication channels, even with good intentions, can create gaps in the information trail and undermine the accountability framework. This can lead to situations where responsibility for patient care becomes unclear, increasing the risk of errors and hindering effective problem solving. Professionals should employ a decision-making framework that begins with identifying the communication objective and the intended audience. This involves selecting the most appropriate communication method based on the urgency, complexity, and sensitivity of the information. A critical step is to anticipate potential barriers to effective communication and proactively implement strategies to overcome them, such as using teach-back methods or read-back protocols. Finally, professionals must continuously evaluate the effectiveness of their communication and be prepared to adapt their approach to ensure clarity and understanding, always prioritizing patient safety and adherence to established protocols. Question 9. The monitoring system demonstrates a consistent pattern of incomplete patient information transfer during shift changes and between departments, leading to near misses and delayed interventions. Which of the following strategies represents the most effective process optimization for enhancing communication among healthcare teams in this context, aligning with U.S. regulatory frameworks for patient safety? Option A. Schedule monthly team meetings to discuss communication challenges without implementing specific interventions. Option B. Rely on informal verbal updates and personal notes exchanged between team members. Option C. Introduce a new electronic health record module for communication without comprehensive training. Option D. Implement standardized communication tools like SBAR for all patient handoffs and interdepartmental transfers. The correct answer is D. Implement standardized communication tools like SBAR for all patient handoffs and interdepartmental transfers. Explanation: scenario analysis. This scenario presents a common challenge in healthcare: the breakdown of effective communication leading to potential patient harm. The monitoring system's data highlights a recurring pattern of missed handoffs and incomplete information exchange, directly impacting patient safety. The professional challenge lies in identifying and implementing sustainable strategies to optimize communication processes, moving beyond superficial fixes to address the root causes of these failures. Careful judgment is required to select interventions that are evidence-based, culturally appropriate within the healthcare setting, and aligned with regulatory expectations for patient safety. Correct approach analysis. Implementing standardized communication tools like SBAR, situation, background, assessment, recommendation, during patient handoffs is the correct approach because it provides a structured, concise, and comprehensive framework for information exchange. This standardization reduces ambiguity, ensures critical data is not omitted, and promotes a shared understanding among team members. Regulatory bodies, such as those overseen by the Centers for Medicare and Medicaid Services, CMS, in the U.S., emphasize the importance of effective communication as a core component of patient safety and quality improvement. Adherence to such standardized protocols directly supports compliance with regulations aimed at preventing adverse events and ensuring continuity of care. This approach optimizes the communication process by creating a predictable and reliable method for transferring patient information, thereby enhancing team collaboration and patient outcomes. Incorrect approach is analysis. Relying solely on informal verbal updates without a structured format is professionally unacceptable because it is highly susceptible to individual interpretation, memory lapses, and the omission of critical details. This lack of standardization directly violates the spirit and often the letter of regulations that mandate clear and accurate patient information transfer to prevent medical errors. Such an approach fosters an environment where patient safety is compromised due to the inherent unreliability of unstructured communication. Introducing a new electronic health record, AIR, module without adequate training or integration into existing workflows is professionally problematic because it can exacerbate communication breakdowns rather than solve them. While technology can be a tool for improvement, its implementation must be carefully planned and executed. Without proper training and workflow integration, the EHR can become a barrier to communication, leading to frustration, workarounds, and potentially more errors. This approach fails to address the fundamental process optimization needed and can lead to non-compliance with regulations that expect functional and effective patient care systems. Conducting sporadic team meetings to discuss communication issues without implementing specific, actionable changes is professionally insufficient. While raising awareness is a first step, it does not constitute process optimization. Regulations and best practices demand proactive and systematic improvements. Without concrete strategies and tools to address the identified communication gaps, these meetings become a superficial exercise that fails to achieve tangible improvements in patient safety and can be seen as a failure to implement required quality improvement measures. Professional reasoning. Professionals facing this scenario should employ a systematic approach to process optimization. First, they must analyze the data from the monitoring system to identify specific communication breakdowns and their impact. Second, they should consult evidence-based practices and regulatory guidelines, e.g., Joint Commission standards in the U.S. for communication during handoffs, to identify effective strategies. Third, they should involve the healthcare team in selecting and implementing solutions, ensuring buy-in and addressing workflow integration. Fourth, they must establish metrics to monitor the effectiveness of implemented strategies and be prepared to iterate and refine their approach based on ongoing data analysis. This iterative, data-driven, and team-centered approach ensures that interventions are targeted, effective, and sustainable, aligning with professional ethical obligations and regulatory requirements for patient safety. Question 10. The assessment process reveals a statistically significant dip in staff reporting of near misses and a perception among some departments that management is not responsive to safety concerns. Which of the following approaches best addresses these findings to foster a more robust safety culture? Option A. Implement a mandatory, organization-wide training program on the importance of near-miss reporting and establish a new anonymous reporting hotline, assuming these will address the observed decline. Option B. Request individual staff members to submit written reports detailing their specific concerns about management responsiveness and near-miss reporting, and then review these reports in isolation. Option C. Focus on increasing the number of safety audits conducted in departments with the lowest reporting rates, believing that increased oversight will naturally improve reporting behaviors. Option D. Conduct a series of focused workshops with frontline staff from all departments to collaboratively analyze the assessment data, identify specific barriers to reporting and perceived unresponsiveness, and co-develop targeted action plans for improvement. The correct answer is D. Conduct a series of focused workshops with frontline staff from all departments to collaboratively analyze the assessment data, identify specific barriers to reporting and perceived unresponsiveness, and co-develop targeted action plans for improvement. Explanation. This scenario presents a common challenge in patient safety, interpreting and acting upon data from safety culture assessments. The professional challenge lies in moving beyond simply collecting data to actively using it to drive meaningful improvement, ensuring that interventions are evidence-based and aligned with regulatory expectations for quality improvement and patient safety. Careful judgment is required to select the most effective and compliant method for addressing identified gaps. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and collaborative strategy for improvement. This aligns with the principles of continuous quality improvement mandated by regulatory bodies. By involving frontline staff in the analysis and action planning, it fosters ownership and ensures that interventions are practical and relevant to their daily work, thereby increasing the likelihood of sustained positive change. This approach also supports the ethical obligation to actively seek and address systemic issues that could compromise patient safety. An incorrect approach that focuses solely on top-down mandates without staff input fails to acknowledge the importance of frontline experience in identifying root causes and developing effective solutions. This can lead to interventions that are perceived as irrelevant or burdensome, undermining the very safety culture they aim to improve. Ethically, it can be seen as a failure to engage the workforce in a meaningful way, potentially violating principles of shared responsibility for patient safety. Another incorrect approach that relies on anecdotal evidence or isolated incidents, rather than comprehensive assessment data, risks misdirecting resources and efforts. This can lead to superficial fixes that do not address underlying systemic issues, potentially leaving patients vulnerable. It also represents a failure to adhere to best practices in quality improvement, which emphasize data-driven decision-making. A further incorrect approach that involves implementing generic, uncustomized interventions without considering the specific context of the organization or the findings of the assessment is unlikely to be effective. This can be seen as a failure to exercise due diligence in patient safety efforts and may not meet regulatory expectations for tailored quality improvement initiatives. The professional reasoning process for similar situations should involve 1. Thoroughly reviewing the assessment data to identify key themes and areas of concern. 2. Engaging frontline staff and leadership in a discussion of the findings to gain diverse perspectives and validate interpretations. 3. Prioritizing areas for improvement based on potential impact on patient safety and feasibility of intervention. 4. Developing a targeted action plan with clear objectives, responsibilities, and timelines. 5. Implementing the plan and establishing mechanisms for ongoing monitoring and evaluation of its effectiveness. 6. Ensuring all actions are documented and aligned with relevant regulatory requirements for patient safety and quality improvement. Question 11. The monitoring system demonstrates a critical alert indicating a patient's vital signs are rapidly deteriorating, requiring immediate administration of a specific medication. However, the electronic health record indicates this medication is currently on a temporary hold due to a recent, unconfirmed report of a rare adverse reaction, and the standard protocol requires a physician's explicit order for any deviation from the hold. The nurse recognizes the immediate life-saving potential of the medication for this patient's current condition. What is the most appropriate course of action? Option A. Delay administering the medication until a physician can be contacted to provide an explicit order, even if it means the patient's condition worsens. Option B. Administer the medication immediately to stabilize the patient, and then document the event as a routine medication administration without mentioning the hold or deviation. Option C. Administer the medication to stabilize the patient and do not report the deviation, assuming the immediate need outweighs the reporting requirement. Option D. Administer the medication immediately to stabilize the patient, and then initiate the process for a formal deviation report and seek physician authorization for the administration. The correct answer is D. Administer the medication immediately to stabilize the patient, and then initiate the process for a formal deviation report and seek physician authorization for the administration. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the conflict between immediate patient needs and established protocols, compounded by potential resource limitations and the need for clear communication. The healthcare professional must balance the urgency of the situation with the requirement for accurate documentation and adherence to safety guidelines. The ethical dilemma lies in deciding how to proceed when a deviation from standard procedure might offer immediate relief, but carries inherent risks and could undermine future safety efforts if not handled transparently and appropriately. Correct approach analysis. The correct approach prioritizes patient safety through immediate, albeit temporary, intervention while simultaneously initiating the process for formal deviation and reporting. This aligns with the fundamental ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. By providing the necessary medication, the immediate risk to the patient is mitigated. Simultaneously, initiating the deviation report and seeking appropriate authorization demonstrates adherence to regulatory frameworks that mandate transparency, accountability, and continuous quality improvement. This approach ensures that the patient receives timely care while also contributing to the learning and refinement of safety protocols, preventing similar situations from arising without proper oversight. This reflects best professional practice by acknowledging the immediate clinical imperative while upholding the integrity of the safety system. Incorrect approaches analysis. One incorrect approach involves administering the medication without any attempt to follow the deviation reporting process. This fails to uphold regulatory requirements for documenting deviations and seeking appropriate authorization. It bypasses established safety checks designed to prevent errors and ensure that all interventions are clinically justified and monitored. Ethically, this could be seen as acting unilaterally without considering the broader implications for patient safety and organizational policy, potentially leading to a lack of oversight and accountability. Another incorrect approach is to delay administering the medication until the formal deviation process is fully completed. prioritizes protocol adherence over immediate patient need, potentially leading to patient harm or deterioration. While adherence to protocol is crucial for safety, it should not come at the expense of a patient's well-being when a clear and present danger exists. This approach fails the principle of beneficence and could be considered negligent if the delay results in adverse outcomes. A third incorrect approach is to administer the medication and then fail to report the deviation at all. This represents a significant ethical and regulatory failure. It undermines the organization's ability to track, analyze, and learn from deviations, thereby compromising future patient safety efforts. It also demonstrates a lack of accountability and transparency, which are cornerstones of professional healthcare practice and regulatory compliance. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, assess the immediate risk to the patient and the potential benefits of intervention. Second, consult available protocols and guidelines, identifying any conflicts or ambiguities. Third, consider the ethical principles at play, particularly beneficence, non-maleficence, autonomy, and justice. Fourth, if an immediate intervention is necessary and deviates from protocol, prioritize patient safety, while simultaneously initiating the formal reporting and authorization process as soon as practically possible. This involves clear communication with supervisors and relevant departments to ensure transparency and compliance. The goal is to achieve the best possible patient outcome while upholding the integrity of the safety and regulatory framework. Question 12. Operational review demonstrates a high volume of near misses related to medication administration errors. To optimize the process for identifying and mitigating future risks, which of the following approaches to risk assessment would be most appropriate for a certified professional in patient safety to implement? Option A. Prioritize risk mitigation efforts based on the severity of the most recently reported medication errors, without a systematic analysis of underlying causes. Option B. Conduct a failure mode and effects analysis (FME) to systematically identify potential failure points in the medication administration process, analyze their causes and effects, and develop proactive mitigation strategies. Option C. Rely on incident reports alone to identify the most frequent types of medication errors and implement immediate corrective actions based on these reports. Option D. Perform a quick walkthrough of the medication administration area to observe staff workflow and identify any obvious deviations from standard procedures. Correct answer is B. Conduct a failure mode and effects analysis (FME) to systematically identify potential failure points in the medication administration process, analyze their causes and effects, and develop proactive mitigation strategies. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for process improvement with the imperative to conduct a thorough and compliant risk assessment. The Certified Professional in Patient Safety (CPPS) must ensure that any chosen risk assessment technique is not only effective in identifying potential harms, but also aligns with established patient safety frameworks and regulatory expectations within the specified jurisdiction. The pressure to demonstrate tangible improvements can sometimes lead to shortcuts, which can compromise the integrity of the risk assessment process and potentially overlook critical vulnerabilities. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based methodology for risk assessment. By selecting a technique that allows for detailed analysis of potential failure modes and their consequences, the CPPS can proactively identify and mitigate risks before they impact patient care. This aligns with the core principles of patient safety, which emphasize a proactive rather than reactive approach to harm prevention. Furthermore, adhering to established risk assessment methodologies ensures that the findings are robust, defensible, and can be used to inform meaningful quality improvement initiatives, thereby meeting regulatory expectations for a culture of safety and continuous improvement. An incorrect approach that relies solely on anecdotal evidence or superficial observation fails to meet professional standards because it lacks the rigor necessary for effective risk identification. This can lead to a false sense of security or the misallocation of resources to address less significant risks. Ethically, this approach breaches the duty of care to patients by not undertaking a comprehensive evaluation of potential harms. Another incorrect approach that focuses only on the most obvious or frequently occurring incidents overlooks the potential for rare but severe adverse events, which can have catastrophic consequences. This selective focus is a regulatory failure as it does not demonstrate a commitment to a comprehensive safety management system. A third incorrect approach that prioritizes speed over thoroughness risks, generating incomplete or inaccurate risk profiles. This can result in the implementation of ineffective interventions or the failure to address root causes, thereby undermining patient safety and potentially violating regulations that mandate diligent risk management. Professionals should employ a decision-making process that begins with clearly defining the scope and objectives of the risk assessment. They should then identify and evaluate various risk assessment techniques, considering their suitability for the specific context, the availability of data, and the required depth of analysis. The chosen technique should be validated against established patient safety principles and any relevant jurisdictional guidelines. A critical step involves engaging relevant stakeholders, including frontline staff, to gather diverse perspectives and ensure the comprehensiveness of the assessment. Finally, the findings should be documented meticulously, and the results should be used to drive targeted and effective risk mitigation strategies, with ongoing monitoring and evaluation to ensure sustained improvement. Question 13. Market research demonstrates that a new, AI-driven diagnostic imaging system has the potential to significantly improve diagnostic accuracy and reduce turnaround times in a hospital setting. The hospital administration is eager to implement this technology to enhance patient care and operational efficiency. However, the existing physical layout of the radiology department, including the placement of imaging equipment, patient waiting areas, and staff workstations, was designed for older technology and may not be optimal for the new system's workflow and safety requirements. Which of the following approaches best aligns with designing for safety in this context, considering the regulatory framework for healthcare facilities and patient safety principles? Option A. Prioritize the cost-effectiveness of the new AI-driven system by implementing it with minimal modifications to the existing physical environment, focusing primarily on the technical performance of the AI software. Option B. Proceed with the installation of the new AI-driven system in the current physical layout, relying on staff to adapt their workflows, and assuming that any safety issues will be identified and addressed through the hospital's standard incident reporting system after implementation. Option C. Implement the new AI-driven system immediately, and then conduct a retrospective safety audit after a period of operation to identify any necessary environmental or system adjustments. Option D. Conduct a comprehensive environmental and system design review of the radiology department, specifically evaluating how the new AI-driven system will integrate with the existing physical layout, patient flow, staff workflow, and potential human factors issues to proactively identify and mitigate risks before full implementation. The correct answer is D. Conduct a comprehensive environmental and system design review of the radiology department, specifically evaluating how the new AI-driven system will integrate with the existing physical layout, patient flow, staff workflow, and potential human factors issues to proactively identify and mitigate risks before full implementation. Explanation. This scenario presents a common challenge in patient safety, balancing innovation with established safety principles and regulatory compliance. The introduction of new technology, while promising improved care, also introduces novel risks that must be proactively identified and mitigated. The professional challenge lies in the need to integrate this new system without compromising existing safety protocols or introducing new hazards, all while adhering to the specific regulatory framework governing healthcare facilities. Careful judgment is required to ensure that the design choices prioritize patient well-being and align with the principles of safe system design. The correct approach represents best professional practice because it adopts a proactive, systems-thinking methodology aligned with the core tenets of patient safety and regulatory expectations. By conducting a thorough risk assessment that considers the entire patient journey and potential failure modes of the new system, the team is demonstrating due diligence. This aligns with regulatory requirements that mandate a safe environment of care and the implementation of systems to prevent harm. The focus on human factors, workflow integration, and staff training ensures that the technology is not only technically sound, but also usable and safe in practice, minimizing the likelihood of errors. This approach embodies the principle of designing for safety by anticipating potential problems and building in safeguards from the outset. An incorrect approach that focuses solely on the technological capabilities without a comprehensive safety evaluation, fails to meet regulatory obligations. Such an approach risks introducing unforeseen hazards, violating the mandate for a safe environment, and potentially leading to patient harm. Ethically, it represents a failure to prioritize patient well-being. Another incorrect approach that prioritizes cost savings over thorough safety integration overlooks the fundamental responsibility to provide safe care. Regulatory bodies often have specific guidelines regarding capital expenditures for safety improvements, and neglecting these can lead to non-compliance and increased risk. An approach that relies on post-implementation incident reporting to identify safety issues is reactive rather than proactive. While incident reporting is crucial, it is a lagging indicator. Best practice dictates anticipating and preventing harm, not merely reacting to it after it has occurred, which is a failure to meet the proactive safety standards expected by regulatory bodies. Professionals should employ a decision-making framework that begins with understanding the regulatory landscape and patient safety principles. This involves a comprehensive risk assessment process that considers all aspects of the system, including environmental factors, human-machine interaction, and workflow. Engaging multidisciplinary teams, including frontline staff, is crucial for identifying potential hazards and developing effective mitigation strategies. The process should be iterative, with continuous evaluation and refinement of the design based on emerging data and feedback. Prioritizing patient safety and regulatory compliance should be the guiding principles throughout the design and implementation phases. Question 14. Compliance review shows that during a recent multidisciplinary team meeting discussing a patient's complex care plan, the healthcare team made several key decisions regarding medication adjustments and therapy schedules without directly involving the patient or their designated family member in the discussion. The rationale provided by the team was that the decisions were based on the latest clinical evidence and were deemed to be in the patient's best interest, and that involving the patient might lead to confusion or anxiety. Which of the following approaches best upholds the principles of patient engagement and involvement in this scenario? Option A. The healthcare team should schedule a follow-up meeting with the patient and their family to clearly explain the rationale behind the decisions, present the available options in an understandable manner, and actively solicit their input and preferences before finalizing the care plan. Option B. The healthcare team should proceed with the implemented decisions, as their clinical expertise ensures the best possible outcome for the patient, and patient involvement could potentially compromise the effectiveness of the treatment. Option C. The healthcare team should inform the patient that decisions have been made for their benefit and encourage them to ask questions, but the final decisions remain with the clinical team to ensure optimal safety and efficiency. Option D. The healthcare team should document the decisions made and provide the patient with a summary of the care plan, trusting that the patient will adhere to the prescribed course of action based on the team's professional judgment. The correct answer is A. The healthcare team should schedule a follow-up meeting with the patient and their family to clearly explain the rationale behind the decisions, present the available options in an understandable manner, and actively solicit their input and preferences before finalizing the care plan. Explanation. Scenario analysis. This scenario presents a common challenge in patient safety, where a well-intentioned but paternalistic approach to care delivery inadvertently excludes the patient from crucial decision-making processes. The professional challenge lies in balancing the healthcare team's expertise and perceived best interests of the patient with the patient's fundamental right to autonomy and involvement in their own care. Navigating this requires a delicate interplay of communication, empathy, and adherence to patient-centered care principles, which are foundational to effective patient safety. Correct approach analysis. The correct approach prioritizes open communication and shared decision-making. It involves actively seeking the patient's input, explaining the rationale behind treatment options in understandable terms, and respecting their preferences and values. This aligns with the core principles of patient engagement and involvement, which are increasingly recognized as critical components of safe and effective healthcare. Regulatory frameworks and ethical guidelines consistently emphasize patient autonomy, informed consent, and the right of patients to participate in decisions about their treatment. By empowering the patient, this approach fosters trust, improves adherence to treatment plans, and ultimately enhances patient safety by ensuring care is aligned with the patient's goals and understanding. Incorrect approach is analysis. One incorrect approach involves the healthcare team making all decisions without adequately consulting the patient. This constitutes a failure in obtaining informed consent, a cornerstone of patient rights and regulatory compliance. It undermines patient autonomy and can lead to care that is not aligned with the patient's wishes or values, increasing the risk of adverse events or dissatisfaction. Ethically, it is paternalistic and disrespectful of the patient's inherent dignity. Another incorrect approach might involve presenting information in overly technical jargon or at a pace that overwhelms the patient, effectively preventing meaningful engagement. While seemingly providing information, this approach fails to ensure comprehension and true understanding, thus negating the purpose of patient involvement. This can be seen as a breach of the duty to communicate effectively and a failure to uphold the spirit of patient-centered care, even if technically some information was conveyed. A third incorrect approach could be to dismiss the patient's concerns or preferences without thorough consideration, perhaps due to time constraints or a belief that the clinical team knows best. This not only erodes trust, but also risks overlooking crucial patient insights that could impact safety. It violates ethical principles of respect for persons and can lead to suboptimal care decisions, directly impacting patient safety. Professional reasoning. When faced with such a situation, a healthcare professional should employ a patient-centered decision-making framework. This involves 1. Assessing the patient's current understanding and capacity to participate. 2. Clearly and compassionately communicating all relevant information, using plain language and checking for understanding. 3. Actively soliciting the patient's preferences, values, and concerns. 4. Collaboratively exploring treatment options, weighing risks and benefits together. 5. Documenting the shared decision-making process and the patient's informed choices. This systematic approach ensures that patient engagement is not merely a procedural step, but a genuine partnership in care, maximizing safety and respecting individual rights. Question 15. The efficiency study reveals a recurring medication administration error rate that is impacting workflow. To optimize the process and reduce this error rate, which of the following approaches best aligns with the principles of learning from errors for sustained patient safety improvement? Option A. Implement immediate procedural changes to streamline the medication administration steps, focusing on reducing the time taken for each administration. Option B. Retrain staff involved in the medication administration process with a focus on reinforcing existing protocols and emphasizing individual accountability for adherence. Option C. Conduct a thorough root cause analysis (RCA) to identify all contributing factors, including system, process, and human elements, and develop targeted interventions based on the RCA findings. Option D. Analyze the error data to identify the specific individuals most frequently associated with the errors and implement performance improvement plans for those individuals. The correct answer is A. Implement immediate procedural changes to streamline the medication administration steps, focusing on reducing the time taken for each administration. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for process improvement with the imperative to thoroughly understand the underlying causes of errors to prevent recurrence. A superficial approach to error analysis, driven solely by efficiency metrics, risks missing critical systemic issues that contribute to patient harm. Careful judgment is required to ensure that the pursuit of efficiency does not compromise the depth and rigor of patient safety investigations. The correct approach represents best professional practice because it prioritizes a systematic and comprehensive root cause analysis, RCA, that goes beyond immediate process fixes. This aligns with the fundamental principles of patient safety, which emphasize learning from adverse events and near misses to implement sustainable improvements. By focusing on identifying the why behind the error, rather than just the what, this approach fosters a culture of safety and continuous improvement, as mandated by patient safety frameworks that encourage proactive identification and mitigation of risks. This method ensures that interventions are targeted at the most fundamental causes, thereby reducing the likelihood of similar errors in the future and upholding the ethical obligation to provide safe patient care. An incorrect approach that focuses solely on immediate process adjustments without a thorough RCA fails to address the systemic vulnerabilities that led to the error. This represents a regulatory and ethical failure because it neglects the duty to investigate adverse events comprehensively, potentially leaving latent conditions unaddressed and increasing the risk of future harm. Such an approach can be seen as a superficial response that does not meet the standards of due diligence in patient safety. Another incorrect approach that involves blaming individuals for the error is a significant ethical and regulatory failure. It contravenes principles of just culture, which advocate for a non-punitive environment that encourages reporting of errors and near misses. Focusing on blame hinders open communication, discourages learning, and can lead to a cover-up of systemic issues, directly violating patient safety mandates that require a systems-thinking approach to error analysis. Professionals should employ a decision-making framework that begins with acknowledging the error or near miss. This is followed by initiating a structured RCA process, which involves gathering data, identifying contributing factors, determining root causes, and developing actionable recommendations. The decision to implement changes should be based on the findings of the RCA, prioritizing interventions that address the most significant risks and have the greatest potential to improve patient safety. This framework emphasizes a commitment to learning, transparency, and continuous improvement, ensuring that patient safety remains the paramount concern. Question 16. Stakeholder feedback indicates a potential gap in the current protocol for managing patients with acute respiratory distress syndrome (ARDS) post-extubation, with some nurses reporting uncertainty about specific weaning parameters and monitoring frequency. The feedback suggests a possible increase in readmission rates for ARDS patients due to complications arising shortly after discharge. What is the most appropriate next step for the patient safety team to address this concern? Option A. Immediately revise the existing ARDS post-extubation protocol by adding a section on weaning parameters and increasing the recommended monitoring frequency based on the nurse's anecdotal reports. Option B. Initiate a formal root cause analysis, RCA, to investigate the reported gap in the ARDS post-extubation protocol. Gather data on readmission rates and identify underlying contributing factors before developing and implementing revised protocols. Option C. Schedule a meeting with the reporting nurses to gather more anecdotal evidence and then file the feedback for future review if similar concerns arise from other departments. Option D. Disseminate a memo to all nursing staff reminding them of the current ARDS post-extubation protocol and emphasizing the importance of adhering to existing guidelines. The correct answer is B. Initiate a formal root cause analysis, RCA, to investigate the reported gap in the ARDS post-extubation protocol, gather data on readmission rates, and identify underlying contributing factors before developing and implementing revised protocols. Explanation. Scenario analysis. This scenario presents a common yet challenging situation in patient safety where a perceived gap in a critical care pathway, identified through stakeholder feedback, requires a robust risk management response. The challenge lies in balancing the urgency of addressing potential patient harm with the need for a systematic, evidence-based approach that adheres to regulatory requirements and organizational policies. The pressure to act quickly, coupled with potential resource constraints and differing opinions among stakeholders, necessitates careful judgment and a structured decision-making process. Correct approach analysis. The correct approach involves a comprehensive risk assessment and management process. This aligns with established patient safety frameworks and regulatory expectations, such as those promoted by the Joint Commission in the U.S., which mandates a proactive and systematic approach to identifying, analyzing, and mitigating risks. Specifically, it requires a thorough root cause analysis, RCA, or a similar investigative methodology to understand the underlying factors contributing to the perceived gap. This analysis should inform the development of evidence-based interventions, followed by implementation, monitoring, and evaluation. This systematic process ensures that interventions are targeted, effective, and sustainable, thereby minimizing the risk of patient harm and demonstrating compliance with patient safety standards. Incorrect approaches analysis. One incorrect approach would be to immediately implement a new protocol based solely on the anecdotal feedback without a formal investigation. This bypasses the critical step of understanding the root causes and potential unintended consequences, potentially leading to ineffective or even harmful interventions. This failure to conduct a thorough risk assessment violates principles of sound clinical governance and regulatory expectations for evidence-based practice. Another incorrect approach would be to dismiss the feedback as an isolated incident without further investigation. This demonstrates a lack of responsiveness to potential safety concerns and a failure to engage with stakeholders, which can erode trust and hinder a culture of safety. Regulatory bodies often emphasize the importance of a robust reporting and learning system, and ignoring feedback contradicts this principle. A third incorrect approach would be to implement a superficial change, such as a minor wording adjustment in an existing document, without addressing the systemic issues identified by the feedback. This represents a failure to engage in meaningful risk mitigation and can create a false sense of security, leaving the underlying risks unaddressed and potentially leading to continued patient harm. This approach fails to meet the standard of due diligence expected in patient safety management. Professional reasoning. Professionals should utilize a structured risk management framework. This involves 1. Acknowledging and documenting all stakeholder feedback. 2. Prioritizing concerns based on potential severity and likelihood of harm. 3. Initiating a formal investigation, e.g., RCA, to identify root causes. 4. Developing evidence-based solutions in collaboration with relevant stakeholders. 5. Implementing, monitoring, and evaluating the effectiveness of interventions. 6. Communicating findings and actions to stakeholders. This systematic process ensures that patient safety is prioritized, resources are used effectively, and regulatory compliance is maintained. Question 17. Benchmark analysis indicates that healthcare organizations often struggle to accurately gauge their safety culture. Considering the Certified Professional in Patient Safety Framework, which approach to assessing safety culture is most likely to yield actionable insights and align with best practices for continuous improvement. Option A. Prioritizing the use of informal feedback mechanisms and anecdotal evidence gathered from staff to understand perceptions of safety, while downplaying the need for structured quantitative data collection. Option B. Conducting a comprehensive comparative analysis of multiple validated safety culture assessment tools, considering their psychometric properties and the organization's specific context and objectives. Option C. Selecting the most cost-effective and easiest to administer safety culture assessment tool, regardless of its psychometric properties or demonstrated ability to measure key safety culture constructs. Option D. Solely relying on a single, popular safety culture survey tool that is widely recognized, but may not be specifically validated for the organization's unique patient population or service lines. Correct answer is B. Conducting a comprehensive comparative analysis of multiple validated safety culture assessment tools, considering their psychometric properties and the organization's specific context and objectives. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a nuanced understanding of how different safety culture assessment tools can yield varying interpretations of an organization's safety climate. The challenge lies in selecting the most appropriate method for a specific organizational context and purpose, rather than relying on a single, universally applicable metric. Misinterpreting the data or choosing an inappropriate tool can lead to misdirected improvement efforts, wasted resources, and a failure to address genuine safety vulnerabilities. Correct approach analysis. The correct approach involves a comparative analysis of multiple safety culture assessment tools, considering their psychometric properties, the specific context of the healthcare organization, e.g., size, specialty, existing safety initiatives, and the intended use of the data, e.g., broad organizational assessment, targeted intervention planning. This aligns with best professional practice by ensuring a comprehensive and contextually relevant understanding of safety culture. Regulatory frameworks, such as those guiding accreditation bodies or quality improvement initiatives, often implicitly or explicitly encourage data-driven decision-making and the use of validated assessment methods. Ethically, this approach prioritizes accuracy and effectiveness in patient safety efforts. Incorrect approach is analysis. One incorrect approach is to solely rely on a single, widely publicized survey tool without considering its suitability for the organization's unique characteristics or the specific safety concerns being addressed. This can lead to a superficial understanding of the safety culture, potentially overlooking critical issues or misinterpreting the significance of certain findings. This approach fails to meet the professional obligation to use evidence-based and contextually appropriate methods, potentially violating ethical principles of due diligence in patient safety. Another incorrect approach is to dismiss quantitative survey data entirely in favor of anecdotal evidence or informal observations. While qualitative data is valuable, A comprehensive understanding of safety culture requires systematic measurement. Ignoring quantitative data can lead to biased conclusions and a failure to identify systemic issues that may not be apparent through informal means. This approach risks contravening regulatory expectations for systematic performance monitoring and improvement. Third incorrect approach is to prioritize the ease of administration or cost of a survey tool over its validity and reliability. While resource constraints are a reality, selecting a tool that does not accurately measure safety culture can lead to flawed conclusions and ineffective interventions, ultimately undermining patient safety. This represents a failure to uphold professional standards of rigor and a potential ethical lapse in prioritizing expediency over accuracy. Professional reasoning. Professionals should approach safety culture assessment by first defining the objectives of the assessment. This involves considering what specific aspects of safety culture need to be understood and for what purpose, e.g., identifying areas for improvement, evaluating the impact of an intervention, benchmarking against peers. Subsequently, they should research and critically evaluate available assessment tools, considering their theoretical underpinnings, psychometric properties, validity and reliability, and suitability for the organizational context. A comparative analysis of multiple tools, where feasible, can provide a more robust understanding. The chosen method should be implemented systematically, and the data analyzed with an understanding of its limitations. Finally, the findings should be translated into actionable strategies for safety improvement, with a plan for ongoing monitoring and reassessment. Question 18. Operational review demonstrates that a unit consistently bypasses a mandatory pre-procedure checklist to expedite patient throughput, leading to a slight increase in reported near misses related to equipment readiness. Which of the following actions best upholds the principles of patient safety as defined by U.S. regulatory frameworks? Option A. Document the near misses and recommend a review of the checklist's length and complexity to determine if it can be streamlined without compromising safety. Option B. Acknowledge the increase in near misses but continue the expedited process, focusing on staff training to improve vigilance during the shortened procedure. Option C. Immediately reinstate the mandatory pre-procedure checklist and conduct a root cause analysis of the near misses to identify contributing factors and implement corrective actions. Option D. Implement a new, more advanced technological solution to track equipment readiness, allowing for the continued bypass of the checklist. The correct answer is C. Immediately reinstate the mandatory pre-procedure checklist and conduct a root cause analysis of the near misses to identify contributing factors and implement corrective actions. Explanation. This scenario presents a common challenge in healthcare settings, balancing the immediate need for efficient service delivery with the fundamental imperative of patient safety. The professional challenge lies in recognizing that deviations from established protocols, even if seemingly minor or driven by perceived efficiency gains, can introduce preventable harm. Careful judgment is required to prioritize safety over expediency, understanding that the long-term consequences of a safety lapse far outweigh any short-term operational benefits. The correct approach represents best professional practice because it directly aligns with the core principles of patient safety, as mandated by regulatory frameworks such as the U.S. Department of Health and Human Services, HHS, and the Agency for Healthcare Research and Quality, AHQ. These bodies emphasize a proactive, systems-based approach to identifying and mitigating risks. Adhering to established protocols, conducting thorough root cause analyses when incidents occur, and implementing evidence-based interventions are all critical components of a robust patient safety program. This approach ensures that patient well-being is the paramount consideration, fostering a culture of safety and continuous improvement. An incorrect approach that prioritizes speed over protocol adherence fails to recognize the inherent risks associated with bypassing established safeguards. This can lead to medication errors, diagnostic delays, or procedural complications, all of which constitute direct violations of patient safety standards and ethical obligations. Such an approach demonstrates a disregard for the systematic processes designed to prevent harm, potentially violating regulations like the Health Insurance Portability and Accountability Act, HIPAA. If patient privacy is compromised due to rushed procedures, or the Centers for Medicare and Medicaid Services, CMS, conditions of participation, which require adherence to safety standards. Another incorrect approach that focuses solely on the immediate outcome without investigating the underlying systemic issues ignores the fundamental principle of learning from errors. Patient safety is not merely about preventing individual mistakes, but about understanding why they happen and implementing changes to prevent recurrence. Failing to conduct a root cause analysis or implement corrective actions means that similar incidents are likely to happen again, representing a failure to meet regulatory expectations for quality improvement and patient care. This can also lead to noncompliance with Joint Commission standards, which mandate a culture of safety and continuous improvement. The professional reasoning process for similar situations should involve a hierarchical prioritization of patient safety above all other operational considerations. When faced with a potential conflict between efficiency and safety, professionals must first consult relevant organizational policies and regulatory guidelines. If a deviation from protocol is being considered, a risk assessment should be conducted, evaluating the potential for harm. In cases of actual or near-miss incidents, a thorough root cause analysis is essential to identify contributing factors and develop effective mitigation strategies. This systematic approach, grounded in regulatory compliance and ethical responsibility, ensures that patient well-being remains the central focus of all healthcare activities. Question 19. System analysis indicates that a healthcare organization is seeking to enhance its patient safety initiatives by more effectively incorporating the patient perspective. Which of the following approaches best aligns with current best practices and regulatory expectations for patient engagement and safety? Option A. Establishing formal patient advisory councils and implementing structured feedback mechanisms for safety concerns identified during care delivery and post-discharge. Option B. Presenting patients with a list of predefined safety improvements and asking for their general approval. Option C. Assigning patients the responsibility of directly monitoring and reporting on the adherence of staff to safety protocols without organizational support. Option D. Primarily relying on the collection and analysis of patient complaints submitted through the hospital's general grievance process. The correct answer is A. Establishing formal patient advisory councils and implementing structured feedback mechanisms for safety concerns identified during care delivery and post-discharge. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the imperative to involve patients in safety initiatives with the practical limitations of time, resources, and the potential for patient burden. Healthcare professionals must identify effective and ethical ways to integrate patient perspectives without overwhelming or alienating them, while also ensuring that patient input is actionable and contributes meaningfully to safety improvements. The challenge lies in moving beyond tokenistic involvement to genuine partnership. Correct approach analysis. Actively seeking and integrating patient feedback through structured mechanisms like patient advisory councils, post-discharge surveys focused on safety concerns, and direct observation of care processes by patient representatives represents best professional practice. This approach aligns with the principles of patient-centered care, which is a cornerstone of modern healthcare quality and safety frameworks. Regulatory guidelines, such as those promoted by the Agency for Healthcare Research and Quality (AHQ) in the U.S., emphasize the importance of patient engagement in identifying and mitigating safety risks. Ethically, it upholds the principle of respect for persons by valuing the patient's lived experience and their right to participate in decisions affecting their care and the safety of the healthcare environment. This method ensures that safety initiatives are grounded in the reality of patient experience, leading to more effective and relevant improvements. Incorrect approaches analysis. One incorrect approach is to rely solely on informal, ad hoc patient complaints as the primary source of safety feedback. This is professionally unacceptable because it is reactive rather than proactive, often captures only severe incidents, and may not represent the broader patient population's experiences or concerns. It fails to meet the ethical obligation to systematically seek and address potential safety hazards. Furthermore, it neglects the regulatory expectation for organizations to have robust systems for identifying and learning from safety events, which includes gathering diverse perspectives. Another incorrect approach is to delegate patient safety responsibilities entirely to patients without providing adequate support, training, or clear channels for their input. This is ethically problematic as it places an undue burden on patients and can lead to frustration and disengagement. It also fails to meet professional standards for patient safety, which require healthcare organizations to actively facilitate and manage patient involvement in a structured and supportive manner. Regulatory frameworks expect organizations to provide the necessary infrastructure for effective patient engagement. A third incorrect approach is to present patients with predetermined safety solutions and ask for their agreement, rather than involving them in the identification and development of solutions. This is a superficial form of engagement that does not truly leverage the patient perspective. It is professionally inadequate because it bypasses the opportunity to gain unique insights from patients about the root causes of safety issues and potential innovative solutions. Ethically, it undermines the principle of shared decision-making and respect for patient autonomy in shaping their care environment. Professional reasoning. Professionals should adopt a systematic and inclusive approach to patient involvement in safety. This involves identifying specific opportunities for patient input at various stages of safety initiatives, from problem identification to solution design and evaluation. Professionals should utilize established frameworks for patient engagement, such as those promoted by patient safety organizations, and ensure that feedback mechanisms are accessible, understandable, and responsive. The decision-making process should prioritize creating a culture of partnership where patients are viewed as essential collaborators in achieving a safe healthcare environment, rather than passive recipients of care or mere sources of complaints. Question 20. Assessment of a hospital unit reveals a pattern where junior nurses often hesitate to voice concerns about potential medication errors to senior physicians, leading to near misses. Which of the following strategies is most likely to effectively address this barrier to effective communication and improve patient safety? Option A. Conducting regular team huddles that focus on efficient task completion and brief updates, without specific time allocated for open discussion of concerns. Option B. Implementing a mandatory speak-up training program for all staff that includes simulated scenarios and emphasizes the importance of psychological safety in reporting concerns. Option C. Encouraging senior physicians to provide informal feedback to junior nurses on their communication style during patient interactions. Option D. Enhancing the electronic health record system with more detailed fields for medication reconciliation to ensure all information is captured. Correct answer is B. Implementing a mandatory speak-up training program for all staff that includes simulated scenarios and emphasizes the importance of psychological safety in reporting concerns. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of healthcare communication, particularly when patient safety is at risk. The core challenge lies in identifying and mitigating barriers that impede the accurate and timely exchange of critical information between healthcare providers. Effective communication is foundational to patient safety, as breakdowns can lead to diagnostic errors, medication mistakes, and delayed or inappropriate treatment. Careful judgment is required to discern the most impactful barrier and the most appropriate strategy for its resolution within the established regulatory framework. The correct approach represents best professional practice because it directly addresses a known and significant barrier to effective communication: hierarchical differences and fear of speaking up. In many healthcare settings, junior staff may hesitate to question or challenge senior colleagues, even when they perceive a potential safety issue. This reluctance, often rooted in perceived power dynamics, can lead to critical information being withheld or overlooked. A strategy that actively encourages open dialogue, establishes clear reporting channels, and promotes a culture of psychological safety directly combats this barrier. This aligns with regulatory guidance that emphasizes a non-punitive reporting environment and the importance of a just culture, where concerns can be raised without fear of reprisal, thereby enhancing patient safety. An incorrect approach that focuses solely on improving documentation without addressing the underlying communication dynamics fails, because it treats a symptom rather than the root cause. While clear documentation is important, it does not resolve the issue of a junior clinician being hesitant to voice a concern in real time. This approach neglects the human factors and organizational culture that create communication barriers, potentially leading to continued safety risks. Ethically, this represents a failure to proactively identify and mitigate risks that are within the organization's control. Another incorrect approach that relies on individual training alone is insufficient because it places the onus entirely on the individual without addressing systemic issues. While communication skills training is valuable, it cannot overcome deeply ingrained hierarchical structures or a culture that discourages open feedback. This approach fails to acknowledge that effective communication is a shared responsibility and requires organizational support and structural changes. Regulatory frameworks often mandate organizational responsibility for creating safe environments, not just individual competency. Finally, an approach that prioritizes efficiency over clarity in communication, such as using abbreviations or jargon without ensuring understanding, directly creates a barrier. This is a failure of basic communication principles and can lead to misinterpretations with severe patient safety consequences. It violates the fundamental ethical and regulatory obligation to ensure that information is conveyed accurately and understood by all relevant parties. The professional reasoning process for similar situations should involve a systematic risk assessment. First, identify the potential patient safety event. Second, analyze the contributing factors, specifically looking for communication breakdowns. Third, categorize the type of communication barrier, e.g., hierarchical, language, cultural, technological. Fourth, evaluate the potential impact of each barrier. Fifth, select and implement strategies that directly address the identified root cause, prioritizing those that foster a culture of safety and open communication, and ensuring compliance with relevant patient safety regulations and ethical guidelines.